Hi everybody, this is Dr. James Reade, chiropractic physician and certified functional medicine practitioner. Today we're going to discuss a very complex topic and oftentimes very frustrating if you've been labeled with fibromyalgia. So, of course, most people who have fibromyalgia, recognize that they have, increased, pain sensitivity, their muscles ache, they're sore. They have sleep problems, chronic fatigue, brain fog, maybe gastrointestinal issues, and so on. And so everybody kind of shares a lot of these common symptoms. It's very difficult to diagnose because it's a complex topic. There are many different triggers that can affect people who do have fibromyalgia. You could think of fibromyalgia almost like in two parts. You can think of the areas that are affected here in the brain and also in the spinal cord. And we can refer to that as fibromyalgia upstairs. We'll have another video about that in the near future here. But today what we're going to talk about is fibromyalgia and how it manifests and what's going on here in the rest of your body. What's going on in your muscles, your tendons, your ligaments, your fascia, your blood supply, the lymphatic system, what seems to be in your immune system, what seems to be going on in the rest of the body. So I'm going to refer to this as fibromyalgia, the ground level. So we're going to go ahead and focus on that today. And I just quickly wanted to go ahead, before we get into some of the different triggers that have been researched, they've been finding more and more actually research and noticing how it's so important to take a look at what's going on here with the metabolic function of some of the tissues I mentioned, and also what kind of inflammation is taking place in some of these different tissues as well. So keep in mind, it's like usually metabolic and also immune inflammatory changes that will affect all, the nerves, the blood vessels, the fascia, the muscles, the tendons, the ligaments, et cetera, et cetera. So let's go ahead and explore some of these different triggers, and I hope you find this information valuable. So one other clarification, what are triggers? Well, triggers would be considered some of the underlying root causes of some of the symptoms of fibromyalgia. So I just wanted to go ahead and clarify that one point as well. So before we go on to all the specific triggers, I just wanted to also make one other additional comment and just say that everybody who has fibromyalgia may not have all these particular triggers. They may just have a few of them. Some other people, there can be varying intensity levels of some of these different triggers. So somebody, your fibromyalgia triggers and someone else's fibromyalgia triggers may not be the same. So therefore, the treatments are going to actually be a little bit different as well, too. So I wanted to go ahead and mention that at the very beginning here. But now let's go ahead and discuss some of these triggers that have been identified that can contribute to fibromyalgia symptoms. So let's discuss one of the first root causes of triggers of fibromyalgia. Well, this would actually involve some of your peripheral nerves and also the dorsal root ganglia. Well, what are your peripheral nerves? All right. Well, these are the nerves that are found in the different tissues of your body, in your muscles, your joints, your fascia, the blood vessels, and so on and so forth. And then what is the dorsal root ganglia? Well, that is actually an area just outside the spinal cord. And you can almost think of it kind of like a connection, kind of like a train station, a stop-off place for different nerve connections. And what is interesting about the dorsal root ganglia is that in that particular area, it's located actually close to the opening between your vertebrae. And it's called the intervertebral foramen, okay, or IVF. And what's interesting, since I am a chiropractor, we realize that having improper movement of your joints potentially can affect that particular structural area of the body and have some impact on the dorsal root ganglia. So chiropractic treatments or other types of spinal manipulation or other things that influence the movement of the joints in those areas potentially can have some beneficial effects on some cases of fibromyalgia. So I wanted to kind of point that out to you. Also, too, in that particular area, as I mentioned, it's kind of like the train station or network of different nerves. Those particular nerves are very sensitive to not only mechanical irritations, but also we find inflammatory changes. So they can also cause abnormal pain signaling that actually goes up into the brain, into an area called the thalamus. So this can be that abnormal sensory information, or the information that's being transmitted is a little bit aberrant or a bit off, can change the level of pain sensitivity and how it's interpreted in the brain. And it actually, its origin may be outside the spinal cord or central nervous system and more in the dorsal root ganglia. So we want to go ahead and point some of those things out. The peripheral nerves, okay, the little nerve endings, okay, these nerve endings and the peripheral nerves themselves can be very subject to inflammatory changes and also metabolic changes. So those two things, metabolic and also inflammatory changes, can impact the level of pain sensitivity on some of these nerve endings and also affect the conductance of some of these different signals. Again, that can be one of the origins of the changes in pain sensitivity and muscle problems that most people will experience when they have fibromyalgia. So I'm going to briefly go over some of the things that can alter the metabolism, all right, and sensitivity of some of the nerves. So one of them could be blood sugar imbalances. We can talk about local changes in the pH of the tissue. We can talk about changes in what they call prostaglandins, which are derived from omega-3 and omega-6 fats. And prostaglandins are actually hormones that can influence inflammatory changes. We can have changes in the immune system, almost kind of like an autoimmune type of situation that can occur. We could also have changes in blood flow. We can have changes in mineral balance in that particular area. Mitochondrial changes would be another important thing. So these are just some of the things that can contribute to some of the changes in metabolic function and also pain sensitivity or inflammatory changes that take place at the peripheral level. So there are different tests that we can run, blood tests that can infer and indicate, some of these different mineral imbalances and so on, and some of these other imbalances in the body, such as omega-3 and omega-6 fats. We can also go ahead and do gentle chiropractic treatments as well, too, for those people that are extremely, pain sensitive and so on. So I wanted to go ahead and mention some of those types of things that can be done to help it analyze and see if there are actually some, changes in the body that we can identify and actually treat. So here's another root cause or trigger, and that would be an imbalance between your parasympathetic nervous system and also your sympathetic nervous system. And I try to use the generalization here, an analogy of, you can think of your sympathetic nervous system as being the accelerator pedal. You can think of that parasympathetic as the brake pedal. And most people that do have fibromyalgia, there's this huge imbalance between the parasympathetic and sympathetic balances in the body and the way, somebody can shift between the two. And oftentimes you find people who have fibromyalgia, usually a sympathetic nervous system. The foot's on the accelerator pedal more often than good, and the relative balance is way, way off here. And that, of course, can lead to a lot of different physiological changes, one of which would be decreased, blood flow, okay, in the periphery. You'll have an increase in stress hormone releases. You're going to have, changes in the tension in the fascia when you have these particular imbalances. It also impacts the immune system and how it actually functions and so on. So keep in mind, yeah, this imbalance is huge here, and that this can cause all different types of other symptoms. It can even affect the gastrointestinal tract as well, too. So, yeah, having that imbalance between sympathetic and parasympathetic would be things to consider. And of course, that can be influenced by mental emotional stress. So, doing some different types of stress relief types of, mindfulness. We can also find that, yes, chiropractic treatments can be helpful. And also, there are various different types of herbs. There are different types of minerals and so on, antioxidants that help to balance that sympathetic, parasympathetic activity. So that has to be something that can also be addressed when you're having fibromyalgia types of problems. So another trigger or underlying root cause might be some dysfunction of the adrenal glands. And we're not talking about, the extreme ones of, Addison's or Cushing's, but we're talking about more functional issues with the adrenals. So where are the adrenal glands? Well, these are glands that sit above your kidneys, all right? And, with the name, yes, they do secrete adrenaline, all right? But these glands do so much more than just release adrenaline. They do release different hormones that basically affect your blood sugar levels or energy. It can affect your metabolism again here. It also releases some different hormones that affect mineral balance throughout the body. It can affect blood pressure, fluid dynamics, okay? So inflammatory changes in the body. It also is involved with hormonal balance, sexual hormone balance. So, and it can also influence your thyroid. So these are all things that some of the basic things that the adrenal glands can actually do. One other interesting thing is that, with chronic elevation of the stress hormone cortisol, we find that it will actually, over time, weaken your ligaments, your discs. It will actually cause more, shall we say, flexibility in the joints that are a little bit more excessive, so you're more apt to injure and irritate the tissues and so on. And what's kind of interesting too is that, at first cortisol has anti-inflammatory properties to it, all right? But it also weakens tissue. But over time, what happens, it'll interfere with the repair process and healing of your tissues. So that's not a very good thing to have, elevated levels of cortisol or even low levels of cortisol here. So you want to have a good balance, with your adrenal glands. And as I mentioned too, that they can influence your thyroid. It can influence how the immune system actually functions. It has an effect on the metabolic function of your muscles and also the peripheral nerves. Another interesting thing, it also can affect an enzyme that's found in the ground substance, which is the fluid around that's found in the fascia. Not only can it affect the collagen, but these ground, matrix here, or the ground substance, we call it extracellular matrix. What happens here, it can affect an enzyme called actually matrix metalloproteinases. And so they affect actually the integrity of the ground substance, and again, the fascia and what it does and so on. And when you're dealing with fibromyalgia, you want to deal and consider what's going on with muscle, but also the connective tissue and fascia, muscles, tendons, and ligaments. So there are some tests that we can actually run. One would be actually like an adrenal stress index. It measures actually your cortisol fluctuations and the overall cortisol levels, not just at one point in time in the morning, which a lot of physicians will go ahead and do, and you'll miss a lot of dysfunction and imbalances with the adrenal glands. It'll also measure DHEA. It can also measure some of your other hormones. So this particular salivary hormone test, I highly recommend when somebody does have fibromyalgia issues, because again, the adrenals can be an important component of fibromyalgia symptomatology. Okay, so another trigger and our root cause of fibromyalgia in the periphery or the body would be your hormones, all right? And of course, most everybody recognizes that fibromyalgia seems to be a type of health issue that seems to affect women more predominantly than men. I'm not saying that men cannot have that, all right? But it seems to be mostly with women. And we do find that increased levels of estrogen will actually weaken ligaments and connective tissue. It also affects some of the cells that are found in your fascia. They're called fibrocytes, or fibroblasts, and they actually produce collagen fibers and so on. So the increase in estrogen actually decreases the amount of collagen or the strength of the collagen, therefore affects also things such as your ligaments, your discs, and of course that can cause some lack of integrity in the tissues. You're more apt to have like joint and muscle problems and so on. Now, what's interesting is that the increase in pain sensitivity does not seem to be due to increased estrogen levels. What they're actually finding is that when you have lowered progesterone or lowered testosterone levels, that is what actually increases the peripheral nerve sensitivity. They become more sensitive to the environment around it more than it normally should be. So that was kind of an interesting kind of research that has been finding with the pain sensitivity issue. It's not due to elevated estrogen, but decreased progesterone and testosterone. Now, also, too, when we do have some imbalances in the thyroid, it's very well known that when you have a low thyroid function, yes, it's going to affect fatigue, okay? But it also affects muscle metabolism and energy. It affects the mitochondria. It affects actually the strength of the muscle, the repair process of your tissues. So thyroid imbalances or imbalances in thyroid hormone can also be another issue here that can influence and affect fibromyalgia. So what could someone do if they do have some of these different imbalances? Well, of course, you may want to go ahead and run like a hormone profile just to see, where you're at. But a lot of times you have to start to think, okay, what can affect these different organs that produce these hormones? What can affect my thyroid? What can affect, the production of estrogen, progesterone, testosterone? A lot of times you do find that there can be some underlying inflammatory process in the body that affects the production of all these different hormones. Something might be affecting the ovaries, something might be affecting the testes, something might be affecting the thyroid. So these are all things to go ahead and consider. And of course, there are different tests that can be run to help to determine some of those underlying what's causing these hormonal problems, which then cause your fibromyalgia, rather than kind of chasing around, hey, take this pill to bring down the pain levels of fibromyalgia. It's like, well, you may actually have a hormonal imbalance because of some inflammatory process. So that would be something to go ahead and consider if you have fibromyalgia. So let's discuss another trigger or an underlying root cause of fibromyalgia. Of course, the other thing that we want to take a look at is, inflammation. And some of this inflammation can be caused by an autoimmune problem. So what's autoimmunity? Just briefly, this is where your own immune system produces what they call antibodies, which are proteins. And these particular proteins will actually, along with some of the different immune cells in your body, attach to some of your cells, and they can cause an inflammatory process. So I know I'm very much simplifying this, and we'll talk about autoimmunity in some other video. But for now, let's just say, hey, this is where your immune system goes kind of haywire. It begins to attack your own tissues, and it can actually attack the nerve tissues, okay? Some of the different proteins that are found in your peripheral nerves, and also, of course, in the brain, but we'll reserve our discussion in the periphery. It can also go ahead and produce antibodies that can affect your muscles, the junctions where the nerves actually meet the muscle. And some other different, proteins that are found throughout the body. And there are, some companies that do some specialized tests that actually will do an analysis and find out where you do have some autoimmune or, auto antibodies that are actually produced in the body as well, too. And they can be very, very specific. And, the litany of autoimmune problems is just growing and growing. And the connection between autoimmunity and fibromyalgia has definitely been established in a number of people. So that seems to be an issue that needs to be also addressed if you do have, fibromyalgia. And a lot of times this, has to be, you have to find, the origins of the autoimmunity. And so we'll go ahead and talk a little bit about that too. So let's go ahead and talk about another underlying root cause or trigger, and that would actually be the hyperpermeable gut, or most people have heard of leaky gut. So what happens with the leaky gut is simply this, is that your gut is normally supposed to allow nutrition, good fats, carbohydrates, different proteins, other nutrients that pass through. But when you have a leaky gut, it doesn't do such a great job. So we have certain proteins and other compounds that pass through the lining of your digestive tract, primarily in the small intestine. And you have to remember, you have about 70 to 80% of your entire immune system embedded within your digestive tract. And so what happens is that some of these proteins will cause a reaction, or I should say your immune system reacts to some of these different proteins. They begin to release some other proteins called cytokines. And these are little protein messengers that can get distributed throughout the body via the lymphatic system and the bloodstream. And so they go into the periphery. The cytokines can then signal to other immune cells and even other cells, and it can cause a inflammatory response or a change in metabolism. And also, too, when you have this release of cytokines and so on, that might be a trigger for autoimmunity. So we can see how this might be all kind of tied in together. So we find that the cytokines that cause the inflammation of the muscles, the tendons, the fascia, the ligaments, all over the place. So this is another underlying cause of fibromyalgia. Again, there are tests to, see, do you have a leaky gut? What is the status of your microbiome, by the way? Because if you take a look at some of our prior videos and also some of our other articles, we talk about the importance of having a proper balanced microbiome. And so, to address leaky gut, yes, there are a multitude of different types of compounds, herbals, and so on, phytonutrients, zinc, other things that can actually help to heal the leaky gut, but also different types of probiotics and prebiotics, having the right kinds of fibers in your diet, avoiding inflammatory foods and so on. So what comes to my point here too, what can be another underlying trigger, and this can be spun off because of a leaky gut, could be food sensitivities. All right, so the food sensitivities can cause, because it will stimulate the immune system, you get cytokine production, or they pass through the lining of your bloodstream, they're not processed correctly, and it can cause inflammatory changes elsewhere. I guess one small example would be nightshades. Okay, so like your tomatoes, potatoes, your peppers. These are things that contain some compounds in them that actually will cause inflammation in the periphery. And they do know that can cause potentially joint problems and muscle achiness and increased pain sensitivities. So getting back to the leaky gut, yeah, there can be like food sensitivities. Some other things that can come into play here is that, yes, there may be other microorganisms that pass through. They can cause an inflammatory change here. So this is another thing to kind of go ahead and think about as well. That can be a causation of some of this fibromyalgia symptomatology. Let's go ahead and talk about another type of trigger or underlying root cause of fibromyalgia in the periphery or in the body, and that would be inflammation and also oxidative stress. So there are many different things that can cause inflammatory changes in some of the different tissues, such as your muscles, your tendons, your ligaments, the small little blood vessels and lymph vessels, your fascia, the ground substance or the fluid that bathes all your connective tissues. And some of these can be, as we mentioned, food sensitivities. It can also be allergic type of reactions that might take place. We can talk about heavy metals. We can talk about also maybe some underlying chemicals, preservatives. We can find other things found in processed foods that can cause inflammation in the body. How about mycotoxins? We can also talk about other toxins or byproducts or metabolites from bacteria like lipopolysaccharides. They can cause inflammation. So there are many, many different things that can begin to lead to inflammatory changes in the periphery. And again, when you have this chronic, inflammation, it's going to affect the function of the nerves, the muscles, and all these different connective tissues as well, too. So, looking and screening for, different toxins might be another thing that can actually be helpful, looking for maybe some underlying low-level infectious types of issues can also be something that might lead to a inflammatory process and manifest in fibromyalgia symptoms, okay? And it's just interesting is that when the body is in the process of trying to fight an infection, it has a lot of similarities. A lot of times we're like worn down, we're tired, okay? It can be, pain sensitivity. Of course, they found the connection, how about with Epstein-Barr viruses, okay, and fibromyalgia? Well, it doesn't have to just be Epstein-Barr. It can be some other maybe viral particles or bacterium, or it could be fungal organisms or mycoplasmas. But there are so many different things that will begin to cause inflammation. So start to think outside the box. It's just not, okay, I need to take a painkiller or some sort of, anti-inflammatory or something to control autoimmune problems. All right, there may be other things that are contributing to inflammation. That's what makes this kind of a lot of detective work, and it can be difficult to go ahead and treat and kind of nail down some of the different things that can contribute to fibromyalgia. So that's why we're going through all these different triggers and underlying possible root causes. Now, the other thing would be oxidative stress, okay? And now that's basically, a term here where a lot of, when you have oxidative stress, there are a lot of molecules that are kind of unstable. They will actually react with other proteins and other compounds, and they can cause an inflammatory status. And one of the ways to combat that is to make sure that you have plenty of antioxidants, okay? And what do antioxidants do? Well, they remove the instability or the electrical charge or imbalances that, some of these unstable molecules actually have. And so, some of these things might be like minerals, okay? It could be simply magnesium, selenium, manganese, zinc. How about making sure you have proper levels of glutathione, okay? How about N-acetylcysteine, green tea extract, grapeseed extract, CoQ10, taurine, okay? Might be some other things. Some herbals, all right, would be, ginger, turmeric, curcumin, of course. Even virgin olive oil, we find that the polyphenols that are in there actually help to reduce inflammation. And one other interesting thing is melatonin, okay? Now, most people think, isn't that, Dr. Reade, just for sleep? Oh, no, okay? Melatonin is actually a very, very important antioxidant. And what's interesting, a lot of that is manufactured in the middle of the night if you're a healthy person, and melatonin actually helps to rejuvenate the body, bring down inflammation. That's why sleep is so important. And why, maybe people have sleep, disturbances as well, because melatonin helps with getting you to sleep and having a better restorative type of sleep. So, yes, melatonin can be another important antioxidant to combat this oxidative stress issue. So, yes, getting proper sleep. And again, there are some tests that can be run to measure your antioxidant levels. And, doing a micronutrient test would be something that would be helpful to verify some of the levels of these minerals and other antioxidants. And even, some of your different amino acids that also help to contribute and decrease inflammation. So again, inflammation, oxidative stress can be another factor here regarding fibromyalgia symptoms. Let's talk about another one, all right? Yeah, the list goes on and on. And again, to my point that fibromyalgia is not an easy thing to go ahead and address and to diagnose, and everybody's a little bit different, but here's another trigger or underlying root cause. It could be mitochondrial dysfunction. Well, what are mitochondria? Well, basically, most everybody's heard, they're the powerhouse of the cell. Yes, they produce actually your energy currency called ATP. And of course, if you're not producing proper levels of ATP, how can you expect your muscles to function right? Or your nerves? And just a very interesting thing is that some of your more highly metabolic tissues, such as your nerves and muscles, have quite a few mitochondria, okay? Their concentration is relatively high. So, yeah, mitochondrial function is important. And when it's not functioning, not only you're not producing the right levels of ATP, and you're not processing your glucose and carbs and other sources, your fats properly, but it also produces a lot of these unstable molecules. We call it reactive oxidative species, okay? So again, it increases oxidative stress. So again, we got to go back to the minerals and other antioxidants and melatonin, okay? All these different things help assist with proper mitochondrial function. So again, you can do some testing to take a look at mitochondrial function. And I want to kind of add too that having proper, mitochondrial function helps to assist in increasing your longevity and your health. So again, this is just a really important thing, and kind of refer you to, I do have another newsletter and articles about mitochondrial function. So I think you'd find that interesting if you want to delve a little bit deeper into that particular topic. But again, mitochondrial dysfunction can contribute potentially to fibromyalgia issues. So as you can tell, trying to go ahead and treat and take a look at fibromyalgia, trying to figure out what the underlying causes are, can be very complex. And of course, there's not one single pill, not one single diet, not one single little biohack that's going to go ahead and try to help somebody out. I mean, I wish that was the case, but in reality, that's usually not the case. Now, some people, yes, it might be a little bit more simplistic. You may want to go ahead and focus on doing more myofascial types of release, some gentle chiropractic, some types of different massage type of therapies might be more appropriate for certain particular individuals and give them a considerable amount of relief. Other people, it really doesn't do much of anything. So this is where you have to take a look at the underlying biochemistry. Where does it seem to be imbalanced? What kind of is there imbalance in the hormones? Is a problem with the mitochondria? Is there an issue with leaky gut? Food sensitivities. So yes, you may have to alter your diet. And certainly, one of the major things I would say is eat an anti-inflammatory diet to begin with. Avoid processed foods. Those would be all good things. Practicing mindfulness, doing stress relief. And I know I didn't get too much into the psychological aspects or mental health, but yes, that's another component. And yes, it can actually affect your periphery, okay, and not just here upstairs in the brain. So just kind of keep that in mind too, no pun intended, all right? But yes, there are so many different things that can contribute to fibromyalgia. And, going to a practitioner that has that ability to take a look at all these different things, even acupuncture, might be another thing that could be of some, great help to you. So if you do have fibromyalgia, you're having a lot of different types of symptoms, you're wanting to try to find out, hey, what seems to be kind of going on here, what can be done, and what kind of appropriate testing can be done. I would encourage you to go ahead and contact my office at 480-732-0911. And this way we can personally set up a proper evaluation, figure out what particular tests you may actually need to find out what's going on here, what's causing your fibromyalgia types of symptoms. So again, if you are wishing to go ahead and do that, I would encourage you to go ahead and contact our office at 480-732-0911, and one of my staff members will be happy to go ahead and assist you and set up your appointment. And I hope that this video gives you a lot of great information, and I hope it's helpful for you as well. Thanks for watching.